Hey, this is Dr. Renfrow. Let's talk about corrective care. That's what we practice in this office. We use a specific technique called upper cervical care, which means that we adjust the top of the spine to adjust the entire spine. When we look at a spine from the front, we want to see it straight up and down. When we look at it from the side, we want to see certain curvatures. So you see here in the neck, we have what's called a C curve or a lordosis. We have the opposite in the upper back, and we have a C curve in the lumbar spine as well, which is the lower back. When we kind of blow that up and look at an x-ray of the neck, we want to see certain characteristics that indicate that the spine is healthy. Number one, we want to see that nice lordosis, a C curve, and you can see how all of these bones line up very nicely and create a C curve, even though I can't draw a C curve. That's a little bit better. Okay, that allows the discs to move properly, to be nice and healthy in the disc spaces. If we put a line on the bottom of C2 and a line on the bottom of C7, we should get a angle of about 42 degrees. And so that's a healthy spine. And anything less than that is unhealthy, and it's going to adversely affect the nerve system and the body's ability to function normally. Another thing we look at, especially upper cervical chiropractors, is the position of the top bone in the spine, the atlas. And it should be about halfway between the base of the skull and C2. And when the atlas is in the right place, the rest of the spine is going to follow. It kind of unlocks the spine to heal and to move normally, take the stress off of the nerve system and allow the function of the body to return to normal. We also want to see the weight of the head evenly over the spine, fall evenly over the spine. And that allows the spine to move normally, to function normally, to resist damage, stress, and strain, and to protect the nerves instead of stress the nerves. So let's look at some examples here. Look at this x-ray on the left. This would be before corrective care. You can see a loss of the cervical curvature. Instead of 42 degrees, we have about 22 degrees here. Because that neck has straightened out, you can see that it's not aligned properly. So this is not a nice C curve here. And it's put a lot of stress and strain on the discs or the spaces in between the bones where there's a disc. You can look at, especially down here at C5 and C6, severe disc degeneration at that level. You can see how the weight of the head is falling far in front of the spine. So that's putting a lot of stress and strain on the spine. Finally, this joint here at the top of the spine, the relationship between the atlas and the base of the skull is not normal. Look at the film on the right. This is 5.5 weeks into care. The first progress assessment. We can see a improvement in the relationship between the atlas and the skull, and that has allowed the weight of the head to come back over the spine. So instead of falling in front of it, it's evenly distributed over. Much easier for the body to support the head like that than for the body to have to support the head way outside of its center of gravity. Taking stress and strain off of the soft tissues holding the spine together, including the discs. So we can see a little bit of improvement here in the C5, C6 disc in just a short amount of weeks, because that segment's going to be moving a little bit better. It's going to be getting a little bit better blood flow, which means that it's got better nutrients, better oxygen supply, and better liquid or water supply. So that's very good. Also taking stress and strain off of the nerve system, allowing the function of the body to actually function a little bit better. So great result there in just a short amount of time. And that's corrective care. This is probably an above average result for that short amount of time, but still very possible. We see that a lot. Let's look at an individual from the front to the back here. Again, we want to see the spine straight up and down. You can see the line on the base of the skull and the line on the top bone of the neck are not parallel. It's not good. That's causing imbalance in the body. You can see that the middle of the spine and the upper back is here. The neck has to curve to the side, and it's not supporting the head evenly, the weight of the head evenly. And then after that same 5.5, 6 weeks of care at the first progress assessment, we can see the improvement between the base of the skull, the top of the spine, and the way that the body is supporting the head is evenly over the spine, taking a lot of stress and strain off of the spine, the soft tissues in the body, and the nerve system. So again, great result, a little bit better than what we'd say is average. Here's another one. Look at the left. You see that the loss of the cervical curvature, it should be 42 degrees, and here it's about 22 degrees. The weight of the head falling in front of the spine instead of over the spine, and the disrelationship between the very top joint in the spine. Bad news. Good news is 4 months at the 4 months progress assessment. This film indicates improvement of the cervical curve by about 8 degrees. So it's now back to 30 degrees. You can see that the weight of the head has come back over the top of the spine, reducing stress and strain on the spine, the soft tissues that hold the spine together, the soft tissues in the body, as well as the nerve system, which is going to control the body's function. And we can see improved relationship between the top of the spine and the base of the skull. Same thing from the front to the back. You can see the abnormal curvature in the neck here. The weight-bearing properties of the head, of the spine, and the head are not normal. And then after 4 months of care, how much that spine has straightened out and the head has come back over the spine, and just so much improvement there as well between the relationship between the top of the spine and the skull. Let's look at one more very quickly. This is lateral or view from the side, and we can just see the increase of the cervical curvature from 3 degrees to 20 degrees in the course of 4 months. So this is a 4-month progress assessment here on the right. Interestingly enough, you can also see improvement in the disc space at C5 and C6 over that short course of time. So that's what corrective care is all about, is monitoring the improvement in the spine, achieving these things, not just covering up a symptom, not just treating a symptom, and not getting actually better at the root cause of everything. So we want to unlock the spine to help the body not just feel better, but to function and heal better. We want to monitor that process to maintain continual improvement in the structure of the body and the function of the body. So the way that happens is through repair cycles. Repair cycles take place over the course of about 90 days. And during that period, the body is able to heal damage that is interfering with normal function and health. And as long as the spine remains unlocked, in other words, as long as we monitor that individual, adjust them when necessary, then we can make sure that that person's going to continue to regain normal function, normal health improvements, and the degeneration of damage in the body. Our care, corrective care, is less focused on the pain and the symptoms. Even though we are very concerned about the pain and the symptoms going away, we have to focus more on objectively what's going on at the root of the pain and the symptoms. Because if we can get that stabilized, then the pain and the symptoms are going to go away. And we want the pain and the symptoms to go away for good instead of being something that requires continual treatment over time. So less about pain and symptoms, more about quality of life and the ability to maintain productivity and independence over time, to get better. So every day healthier than the last. And that's what we want for you. Thank you so much. Bye-bye.